A rare and deadly lung disease called idiopathic pulmonary fibrosis is on the rise in the U.S., and doctors are scrambling to come up with effective treatments for this little understood condition. Here to tell us more is WSJ's Laura Landro. Laura, thanks so much for being with us.
Good to be here.
First of all, what makes this disease different from other related pulmonary diseases?
Well, I mean, what makes it different is they really don't know what causes it. They know what causes some other things, but the main thing they do know is that it affects way more people than they ever thought, mostly because they're learning more things about the diagnosis, and they know that it causes this irreversible damage that makes it hard for it's scarring, makes it hard for the tissues to transport oxygen into the body, which is what we need to live and breathe.
Absolutely. It sounds terrible, but so it's not directly related then to smoking or directly linked?
Well, smoking is known to be probably a pretty significant cause, but there's also all kinds of other interesting causes. There's, exposures to toxins, maybe wood or metal dust, maybe acid reflux disease may have something to do with it.
Because many non-smokers are
Yes, non-smokers do get this. Maybe they've been exposed to something else.
So it's unclear exactly what What are the symptoms, though? Is it easy to misdiagnose?
Very easy to misdiagnose. It has emphysema-like, asthma-like symptoms, but they are learning more about specific things, like when they listen to the lungs, they might hear crackles that sound like Velcro being pulled, and that's kind of a trigger sign.
So what are some of the ways it's being treated right now, and are these treatments mostly considered experimental?
Well, no, at this point, you've got 2 drugs that were approved by the FDA last year, and they've been very effective in basically stemming the progress, so stopping further decline in the lungs. And those have been, they're very expensive. They cost close to $100,000.
Yeah.
But, like all drug prices, that's a big issue right now, but it does seem to slow the decline in people because, the prognosis is not good. Half of people don't live 2 to 3 years after they've been diagnosed.
Oh, that's terrible. Is this something that is popping up in the later years, or are people of
after
age
50.
50,
and by
okay.
the way, there's some hereditary component. About 15% of people who have it have someone else in the family.
Now, do doctors have any idea why it's on the rise?
Well, partly is better diagnostic techniques.
Okay.
Others are sort of a mystery. Maybe we're being exposed to things in this world that are, causing this to happen. It's sort of almost like an autoimmune response. It's scarring that goes haywire, basically, and they don't really know why.
Now, is there some place in particular people can go if they want to get more information about this disease?
There's a Pulmonary Fibrosis Foundation. The NIH has a ton of information about this. The National Heart, Lung, and Blood Institute. All the websites have very good info on this. And, of course, the drug makers. Esbriet and Ofev are the names of the drugs that are being used. And there are new drugs in clinical trials. So there's progress, but it's still tough for patients who have this.
This is a scary disease. Laura Landro, thank you so much for that.
Thank you.